Emma Rodriguez woke up and couldn't move her legs. 24 hours earlier, she was perfectly healthy. Now, doctors had 48 hours to figure out what was paralyzing her before it reached her lungs. It started with what seemed like a simple cold. Emma, a 28-year-old graphic designer, felt run down. Fever, cough, fatigue. Nothing unusual for flu season. She stayed home from work, rested, and waited for it to pass. But 3 days later, Emma noticed something strange. Her feet felt tingly, like pins and needles. She thought maybe she'd been sitting too long. The tingling spread, turned to numbness, then weakness. By the next morning, when Emma tried to get out of bed, her legs gave out completely. She collapsed at the bottom of the stairs. Her boyfriend found her there, crying, unable to stand. He called 911. In the emergency room, Dr. Michael Foster, a neurologist, examined Emma's legs. He tapped her knees with a reflex hammer. Nothing. Her reflexes were gone. Completely gone. That's when he knew this wasn't just weakness. Something was attacking her nervous system, and it was moving fast. The paralysis was climbing, from her feet to her calves to her thighs. Within hours, Emma's hands started to weaken. She could barely grip a cup. Dr. Foster gathered his team. They had to figure this out. Now, because if the paralysis reached Emma's diaphragm, the muscle that controls breathing, she would stop breathing. She would die. Dr. Foster ordered an emergency spinal tap, a needle inserted into Emma's spine to extract cerebrospinal fluid. The results came back within an hour. Elevated protein levels, abnormal immune cells, and then he knew, Guillain-Barré Syndrome. Emma's own immune system had turned against her. After fighting off that simple cold, her antibodies got confused. They started attacking the protective coating around her nerves, the myelin sheath. Without that coating, electrical signals from Emma's brain couldn't reach her muscles. It's like cutting the insulation off a wire. The signal just stops. Guillain-Barré is rare, 1 in 100,000 people, but it can happen to anyone, usually 2 to 4 weeks after a viral infection. A cold, the flu, even food poisoning, and it moves terrifyingly fast. By the time Dr. Foster made the diagnosis, the paralysis had reached Emma's chest. They rushed her to the ICU. There's no cure for Guillain-Barré. The only treatment was to flood the body with immunoglobulin antibodies from thousands of healthy blood donors. The hope? That these good antibodies would calm Emma's overactive immune system, stop it from attacking her nerves. They hooked Emma up to N4. The treatment would take 5 days. For 72 hours, her boyfriend sat beside her bed, holding her hand, watching her chest rise and fall with the ventilator. Would the treatment work? Or would the paralysis continue climbing? Then, on day 3, her finger moved. Just a twitch, but it was movement. By day 4, Emma was breathing on her own. The attack had stopped, but recovery? That would take months. Emma had to learn to walk again, to grip a fork, to write her own name. Intensive physical therapy, 5 days a week. Her nerves were regenerating, slowly rebuilding their protective coating. But nerve regeneration is painfully slow, millimeters per day. Most Guillain-Barré patients recover fully within 3 to 6 months. But 5% have permanent weakness, and without early treatment, it can be fatal. Today, 6 months later, Emma is walking, working, living her life. She has a small scar on her arm from the 4 lines, and a much deeper appreciation for every single step she takes. She learns something terrifying. Your body's own defenses can turn on you without warning. After even the simplest infection, if you or someone you love develops these symptoms after being sick, tingling or numbness in your hands or feet, weakness that spreads upward, difficulty swallowing or breathing, get to an emergency room immediately. Guillain-Barré moves fast, but so can treatment. Early intervention is everything. It's the difference between full recovery and permanent paralysis, the difference between life and death. Emma got her second chance because her boyfriend didn't hesitate, because Dr. Foster recognized the signs, because she got treatment within 24 hours. Don't wait. Don't assume it's just weakness. Trust your instincts and act fast. Your nervous system is under attack, but you can fight back. If you know the signs, share this story. It could save a life. Like and subscribe for more.